Namaskar, friends. Today we will see the progression of diseases, how they progress. See, friends, see the body is having adaptive physiology of the body. Use it or lose it. See what happens. Adaptive physiology means if you are walking bare feet, initially you will have difficulty, but over some time, weeks or months later, you find it's comfortable because there will be a thick layer forming. Similarly, somebody is playing a guitar, you just see that finger where he is playing the guitar, that area will become hardened. Similarly, lifting weights. Suppose he is lifting weights, his muscles will get improved. If suppose somebody is in a high altitude, so his oxygen levels, his lung capacity would be different, so he is able to manage. Say for example, somebody met with an accident and he was put on a cast. Suppose he broke his hand and they put on a cast. Suppose after 3 months when they open the cast, he find the length of the size of the hand would be reduced, because what happened when it is not used, you lose it. Now, friends, we all know the sources of toxins. We looked at it earlier, but we quickly look at it. Stress can cause sugar toxicity, free radicals, right? Bad bacteria, and then alcohol if you're taking, air pollution, building materials, cigarette smoking, food chemicals. Food chemicals means primarily from the processed foods, packaged foods, factory made foods, herbicides, household goods. We are using very strong cleaning material in the house, they can also lead to toxins in the body. Pesticides, radiation, traffic fumes, type of water what we drink, all this can add up to the toxins in the body. So what we are doing, we are imbibing so many toxins, we are putting in the mouth, we are putting on our skin, or we are remaining in an environment where there is a lot of pollution. So we all know the reasons for all the lifestyle disorders are primarily gut health. Insulin, if gut health is good, if gut health good, this is the secret for good health. Gut health has to be good. Insulin, you have to be sensitive. D and B12 vitamin adequacy are the keys to your health span. Now, what all thing can happen? Lack of hydration. People don't take sufficient quantity of water. Constipation, poor appetite, inflammatory foods, as we discussed, all the processed foods, lack of nutritious foods. All the time we are taking cooked food, we are not taking any fruits and salads and nuts and all that. Insulin resistance, we just discussed that. Lack of exercise, lack of 7 hours night sleep, poor mind management. What happens? Poor mind management. We are not able to deal with the world and we are getting stressed. And D and B vitamin deficiency. And this is what they happen over the period, over the about 10 years or 15 years. People get into chronic inflammation and hormonal imbalance. They cause all the lifestyle disorders. What are the lifestyle disorders, friends? Obesity, diabetes, hypertension, PCOS, etc. So body is adjusting to the habits. See, look at adaptive physiology of the body. Disease is an intelligent adaptation of the body in the prevailing condition, whatever conditions you put. This is an attempt of the part of the body to discard the accumulated waste material. See what happens, there's accumulation of toxins in the body. See, one way we are imbibing so many toxins from the environment and our own food habits, and at the same time from the body they're not going. They can cause what? They can cause heart disease, blood pressure, cholesterol, diabetes, vitamin deficiency, kidney problems, uh, or seizures, all those things. So what happens when you get a insulin resistance? Insulin resistance can cause all these problems. And then they lead obesity. Obesity again causes this. Look at how they're closely related. Insulin resistance causes obesity. Obesity causes hypertension, type 2 diabetes, mood disorders, and all that. And it again causes inflammation. Inflammation again, as I said to you, inflammation is nothing but there is a constant fire in your system, and there is a fight between your immunity system and this inflammation stuff. That's how your inflammation is happening. So, natural removal mechanism of toxins. How the toxins go out of our body, friends? There are four routes. One is from the stools, another is from the urine, another is from the sweat, another is from the breath. So, if you are not able to eliminate these things in a systematic manner every day, then they all get accumulated. When waste does not get clear from these main four routes properly and regularly, body attempts to discard the accumulated waste material by way of cough. See, when you are getting a cough, what is doing? It is throwing out the waste, running nose, throwing the waste, vomiting. What is not required is throwing out the body, loose motions. All these things are lack of appetite, body pains, fever, constipation, gas, etc. See, all these things are primarily because there is a accumulated toxins and you are unable to remove them. On top of it, you are adding up this toxins. So, what are the low immunity signs, friends? See, when you have first of all low immunity means first stage, because these are the initial stages: low energy, bad skin, gastric problem, headache, acidity, constipation, kidney stones, sleep disorders, obesity, itching, leg swelling. All these things are happening because this is the stage one. Stage one means it's starting stage. People neglect it. People low energy, they try to eat more. They don't find out the root cause. Now, what is the second stage? Once we miss the whispers of the body is ignored over a long period of time. The body expresses by shouting with these symptoms. Stage 2. What is stage 2? You've already got an advanced stage of diabetes, hypertension, heart diseases, kidney diseases, tumor, cancer, paralysis. All these problems are second stage. So this is an area where you are on medication, you are disabled, and you have not a fully functional body, and you continue on medication, but there is no much changes you make in your lifestyle. Maybe you are taking coffee without sugar and things like it, but that doesn't work in a long way, friends. If you neglect the second stage symptoms also for quite some time, what happens? Third stage, if one ignores stage 2 symptoms also by not changing lifestyle for a long time, then the body kicks one into ambulance and we have to rush to the intensive care. See, the occasions where the ambulance has to come home and pick up a patient, that means what? He has gone to third stage. Unless there is an accident, that is different. Now, how do we get rid of all these problems, friends? See, there are seven stages. Let's look at it. Seven stages of diseases. See, first stage is lack of energy, vitality, lack of appetite, sleep deprivation, tiredness, etc. Second is accumulation of toxins in the blood, further drain of energy, sluggishness, fever, etc. That is second. Third stage, unpleasant feeling, itchiness. This is called irritation mode. Easily agitated, depression, anxiety, worry, skin, insulin resistance. Look at friend. We have neglected two stages, and when then only we come to insulin resistance. Weight gain, pre-diabetes. This was stage three. The stage three also takes at least 10 years. Next stage is inflammation. Body's natural reaction to toxins in the body is pain and inflammation. People are suffering now. Chronic inflammation leads to hormonal imbalance. Life again, they go to an advanced stage of diabetes, blood pressure, and all that. See, look at this one. The ulceration, repeated suppression, neglect, pain can cause what? Tissue damages. Sixth stage, scarring as a form, toxic material, and see there may be some tumors, hardened tissues. So this is what body is working on it. Body is trying to take care of its survival. A seventh stage is the cancer, friends. Body vitality is very low. Cells are no longer controlled by the brain. Multiplication is haphazard. It's growing haphazardly. Takes a lot of effort to correct. So we are neglecting to a very long period. Now, let's look at it, friends. We need to have good gut health, insulin sensitivity, D and B12 vitamin adequacy are the key for the health span. We all discussed the seven essentials for good health. Now we will look at it: air, water, food, excretion, exercise, rest, and mind management. So all these seven, how do we fine tune in our day-to-day schedule? Friends, today we are going to talk. Suppose somebody wants, no, no, I can't do so many things. I will do only one aspect. What is that one aspect which will contribute to me health? Let's look at what is the number one point. See, the number one point, if at all you learn anything or not, you do anything or not, if you do this step alone, what is this? Stop eating multiple times and taking coffee, tea, etc. in a day. What we are doing, friends, we are having breakfast, lunch, dinner, and then one or two times snacks, one or two times coffee, tea, and somebody is always popping here and there stuff in their mouth. So 6 to 7 times, if they keep eating, every time you eat, there is a sugar high and there is the insulin hike. Over the years, what happens? The insulin levels won't come down. That's how the fasting insulin is very high. When fasting insulin is very high, sugar levels will be under control for many, many years. HbA1c also will be under control. But after some time, what happens? Insulin levels will be very high, sugar levels will be very high because insulin is not working on your body. You're still not diabetes, you're only insulin resistance. But many, many people are in this stage, but they don't know because they're not checking the insulin test at all. And then next point, what you should do, so you don't eat multiple times. Don't keep on taking coffee, tea, etc. in a day. Multiple times eating to be avoided. Then avoid. Next is what? Avoid the high carb foods. You must avoid or reduce sugar, sweets, stimulants like alcohol, drugs. This is stimulants like coffee, tea, cool drinks. This is another area, friends. Cool drinks. People are drinking, holding the bottle, keep on sipping all day, and they are at the very young age, at the age 20 itself, people are diabetic because of this. If this habit alone, if is followed, whatever your current health, you will jump by 40%. That I can assure you, friends. What is the next step? Drinking 3 to 4 liters of water in a day and 45 minutes brisk walk and 2 bowel movements in the morning. This will take care of another 20%. By doing these two, you are 60%. You are already first class. So how to do this? 3 to 4 liters of water in a day. You immediately after wake up in the morning, drink 1 liter water, focus on your mind, on your stomach, and go to the first toilet. After that, go for 45 minutes to 1 hour walk, come back, take rest for 10 minutes, drink 1 liter water again, and go for the second bowel movement. So, what happened? You have hydrated and then you have cleared your bowels. So, this will add up to 60%. 60% you can achieve by only following these two steps, friends. What is the third step? Eat only twice in a day when hungry. See, friends, here is the technique. Nothing in between two meals except water. Understand, other than what anything else is food. So, if you focus this, what you want to eat, you can eat whatever food you want at home, friend. Basically, try and have home cooked food. Have try and have cold pressed oil and use senda namak or Himalayan salt and have two meals of your choice. Absolutely no problem. Somebody is interested in further improving, suppose we have already reached a good stage and you want to further improve, then next is what, friend? If one wants a better result out of two meals every day, we are only suggesting two meals, first meal, second meal. The ideal would be between 11 and 1 o'clock would be the first meal would be ideal, second meal would be between 6 and 8, but it is your convenience. The primary driving factor should be your hunger and your convenience, all that, friends. So what you do, if you are interested in good health, one time you have a cooked meal, second time you have an uncooked meal. What is uncooked meal, friend? You have seasonal fruits, sprouts, and soaked nuts, and cashews, dates, fresh coconut, and seasonal fruit, friends. Look at these are the two varieties. You can have your choice. You can choose the first meal as an uncooked meal or second meal as uncooked meal is your choice. In this approach, friends, there is absolutely no restriction on the quantity of the food, type of food, as we discussed, your choice, friends. Now, see, look at here is one case, friend. The HbA1c was on 11th March is 11.9%. Is one of the follower in our group, and in a span of 5 months, look at the HbA1c has come 6.6% with the minimal tablets. He was just taking one glycomet 500 mg. No, this is a magic food, friend. This has been suggested by Colonel Gautam Guha. Is doing a wonderful job. It's a no carb food, so you can have this is a fresh coconut and curds, some paneer and sabjis. You can have some coconut chutney, some nuts and some salads. So you can have your this food. Then what happens is, friends, when you take this time, two times of food, this one, you are not increasing your sugar levels. And in over a period of time, your sugar levels will come down. People look at, as I said to you, 11.9% HbA1c to 6.6 is excellent. Now, another thing you need to keep in mind, 16 hours fasting. You can do that. Suppose you had second meal, say at 7 o'clock. The first meal you try and take about 11 o'clock, have 14, 15, 16 hours of gap so that you have the fasting mode so that the insulin levels or sugar levels are not going up during that fasting mode. Now, what else, friend? 7 hours sleep is absolutely essential. Night sleep, 10 p.m. to 5 a.m. is very essential. Learn some yoga, meditation, the engineering program so that you know how to handle your managing anxiety and stress. So, what happened? Look, another 10% is gone up. Now, the what is the last one? Once in a 15 days, if you can do a fasting, so that will bring you 100%. Whatever your current level, I can guarantee you in a span of 3, 4 months, you can jump double of the health. You're already good health, you will have an excellent immunity. You're not having a good health, you will be improving substantially, friends. Now, see, friends, what we discussed is the gut health. Gut health is achieved by what? By taking 3 to 4 liters of water, and then two times you are clearing your bowel movements in the morning, and then you are only eating when hungry, and then you are only eating, not a packaged foods and all that. So that will take care of gut health. Insulin sensitivity, how it is achieved? By eating only twice and less of carbs, friend. See, look at the secret, friend. If you are able to manage your fasting sugar and fasting insulin low like these levels, and HbA1c will be all automatically below 5.6, which is very healthy thing, friends. And insulin resistance is below 1.5. Similarly, if you are not following it, this is a six pack, friends. Now let's look at, friend. My name is Gangeshwar Rao. I'm not a doctor, and please pay attention to your talk to your doctor if you're making any changes. Don't give up any medication. There are the 12 parameters one should track, friends. So number of medication in 2014, I was taking 11 medicines. My weight was 69 kg. I'm overweight. All the red means I'm out of sync. Waist size is 36. Blood pressure was okay because I was taking medicines. Fasting sugar was high. Fasting insulin is high. A1C is 7.8% with medication. Lipid profile, triglycerides to HDL ratio is an important test. It's a high sensitive C-reactive protein. This is inflammation marker. D vitamin adequacy, we talked about it, friend. I was 23. B12, 202. So HOMA insulin resistance is 3.5. It should be below 1.5. This is the ideal range. So by following 4 months, Dr. Mantina's natural lifestyle, look at the transformation I had, friends. So everything, almost 10 parameters came into in the range. So from 16% to 83% I've improved by making these changes, friends. Friends, you must invest time and then learn these things so that you can have the right knowledge, and then the right knowledge and discipline are the gateways, friends. These are the few people who have benefited by following this natural lifestyle. If anybody is wanting any support, they can call me on this number. There are certain videos in my YouTube channel. You can enhance your knowledge, and I'm sure you will benefit and share to your friends. Thank you very much, friends, for listening.